The so-called last line of defence is feeling it.
We were fearful of this day to come, and unfortunately, it just arrived.
A 53-year-old personal care worker at St Basil's Aged Care in Fawkner is one of 41 Victorians in intensive care with coronavirus. This morning, staff from Northern Health were sent in to take over as more aged care workers had to isolate.
If staff are coming from a family where someone is unwell, they should really think about making sure that any family member is tested before they're turning up to work.
The AMA wants the federal government to coordinate getting more aged care workers into Victoria to help out.
More needs to be done. We need that surge workforce capacity. We need that coordination.
Aged care in Victoria is on the brink and we need more help.
5 more aged care facilities have recorded positive cases, adding to a growing list. Of the main outbreaks, there are now 73 cases linked to St Basil's, 68 at Estia Health in Ardea and 44 at Glendale Aged Care in Werribee.
When we look around the world, this has been a major issue for all countries, and so we're learning as we go.
The troops have arrived and will be on the streets with public health teams, door-knocking people who don't answer the phone after testing positive.
If for whatever reason you don't answer the phone, then ADF personnel will be knocking on your door and they will bring the public health response to you.
Doctors want that public health response tightened to stage 4 restrictions.
Would send a powerful message to all Victorians that this is a very serious situation.
Masks are our stage 4 in a way.
Police say most people are doing the right thing, wearing masks and staying home except for the 4 reasons. But police issued 101 fines yesterday for people who wouldn't wear masks when they were asked to, conspiracy theorists, and a man who said he was driving across Melbourne to buy cigarettes. And there was this woman deliberately flouting lockdown rules at one of Melbourne's checkpoints.
So where have you come from today?
I don't need to answer your questions.
It's not one of your human rights to endanger other people. It's not one of your human rights to put other people at risk.
A fortnight into the new school term, the risks are showing. More than 40 schools are closed for cleaning and contact tracing. Margaret Paul, ABC News, Melbourne.
When Simon and Rheannon Cutler's daughter Maisie was born, her esophagus hadn't formed properly.
So she has trouble swallowing, and these little stents are Maisie's 3rd surgery.
They live in Wodonga on the Victorian side of the border, but their hospital's paediatric unit is across the Murray River in Albury. On Tuesday, they were waiting in the queue to enter New South Wales for an appointment when Maisie began to choke.
Every time we sort of come to a stop, I'm reaching in the back, suctioning Maisie's stents out, and it's not clearing.
But they were stuck in traffic without an emergency lane to move into. She was eventually able to pull over, and a doctor in the line behind her assisted in suctioning her daughter's throat. It took another 45 minutes to get her to emergency.
I think clearly we need an emergency lane and a more wholesome approach, because our community is not divided by the states, really.
Head of Paediatrics, Dr Mark Norden, says he needs to cross the border many times a day to see patients.
If I'm halfway across and I get called back to Wodonga because there's a flat baby that needs immediate resuscitation, I can't even turn around. I can't move. I'm stuck in the queue.
If I need to travel across the border, it could take me up to an hour to get in there. If that patient is bleeding, they may not survive that.
Some ambulances have been made to wait up to an hour to get through the border crossing, and senior doctors are demanding urgent action from the New South Wales government.
They haven't come to the party to solve these issues. We've been advocating for an emergency lane system for 2 weeks, and it still doesn't exist.
It has been absolute silence from the New South Wales government, except for telling us what to do, and it's got to stop.
It's become a desperate plea from desperate people. Jess Davis, ABC News.